Um, so good morning, everyone. This is the revised MnCHOICES application MCO and MCO delegate call-in session for August the 16th, 2023. We welcome each of you, and we appreciate your attendance today. So this is the team that it always comes to webinars. In that, for this webinar, we have folks who are associated with MCO and MCO delegate questions. So Rakia Banya is here, Sue Kavendru and Deb Maruska are here, Amy Rumpsa is here, Tina Tran is here, Kathleen Bondrum is here. So you're aware of who's attending with me today. This session is being recorded. We're using WebEx audio for this session, and all of you are currently muted. Please raise your hand to ask a question, and then we will call you in the order that hands are raised. When we call on you, we will take you off mute, and then when you're done, we'll put you back on mute. We would really appreciate that you don't put questions in the chat. We really want your questions asked out loud. Other people will be thinking them too, and it gives us a chance to have a good conversation. We've set aside 2 hours for this call, and there are only just a few slides on this PowerPoint, so there should be plenty of time, I hope, to ask all of your questions. So I've got a few items that I'm going to share with you, and then we're going to turn it over to training questions. And like we have done for other call-in sessions, we will try to manage the topics just so that it isn't a chaotic asking similar questions about different things throughout, just to try to give it a little more organization. So I'm going to go through my few items first. So we wanted to first just talk a little bit about help desk forums. We have spoken with the MCOs, and their preferences is the MCO mentor submits the MnCHOICES help desk form. So for delegates, if you would please submit your questions into your staff can submit questions into delegate mentors, and the MCOs would prefer then that you send the delegate mentor send those questions into them. So just so that you're aware, that's kind of the policy that we've been following. One piece that we are hearing you speak to, and we want to make sure that we cover, is this whole piece about staff assignment. And specifically, it shows up for MCO delegate staff because you have many instances of you where you work for one location and then you work for another and you work for another. So it could be a county staff member is working for 3 MCOs. It could be a delegate contracted agency works for 3 managed care organizations. And the questions that you've been bringing in is basically, I pick one, but then I can't pick my location. And so what we have learned from working with many of you is that when you pick your name, the first name, each name is associated with a very specific location. However, you don't know which one that is until after you picked it. So if for some reason you pick the first one and it shows up, in this case, it could show up as DHS, or you pick the second one and you're like, nope, that's still not the one I want. You will just continue to pick these until you get the correct location so that you're aware of it. But it might take several tries for names that are really regular, like if there are a lot of Janes or a lot of Marys or a lot of Sarahs or whatever names those are. Sometimes it's best to just type in the last name, especially if it distinguishes that person from everyone else. It will reduce the amount of scrolling that you have to do. So the other piece we wanted to talk a little bit about is you've had questions about MMIS, and we wanted to make sure we provided the same information to all of you at one time. So MnCHOICES does not auto feed data into MMIS. So when completing an HRA, MnCHOICES for MnCHOICES, the revised MnCHOICES application, you won't need to enter the HRA results into MMIS. For legacy, you'll continue to enter your HRA results into MMIS. And when completing a MnCHOICES assessment for an MCO, for elderly waiver PCA or not eligible for a program, you'll continue to enter all your screening document results into MMIS. We thought it would be helpful for you to see this. This has been communicated in the past, but we thought it'd be useful for you to see it as a slide. Since we anticipated this would be a question that you would have, you may also ask, do you have this PowerPoint anywhere? And the answer is yes. It is in the DSD archive, and so I will just quick show you where that is. So I'm on MnCHOICES County link. I'm going to the training page. The webinar archive link is always at the top of this page. If you go to MnCHOICES, then you can see the PDF sits right here. Again, there are very few slides in here, but if that MMIS slide is helpful to you and you want to share it with your staff, I just wanted to make you aware that that information is the PowerPoint is available there. So one of the pieces that we've been hearing about at our last webinar, and so we just wanted to make sure we came back to it and talked about it, is you may hear things from your users like the elderly waiver residential services tool is blank, or the values aren't coming over from the assessment for that tool. If you hear that kind of conversation, our goal is to give you a way to think about it as skill set so that you know how to solve it. So when this happens, what that means is that the user hasn't moved the status of the support plan from in progress to in progress assessment complete. Okay, and so how you know that is because they'll say, hey, that tool is blank, or the assessment data didn't come over. And that's because they still have the support plan in the in progress status, which means it didn't pull assessment data, or it hasn't pulled assessment data yet. So the steps on this slide are really about, okay, first the person's going to go over and make sure the assessment has some status that is about MMIS in it. Then they're going to say, yep, that's true. And then you're going to go say, okay, yep, I can see the status is in progress, which is why your fields are blank. And so go ahead and choose submit. And by choosing submit, it moves the support plan to in progress assessment complete and pulls the data into the support plan. So the data will then show up in that elderly waiver residential services tool. So here's our plan for today. Our plan is to first talk about health risk assessments and the support plans associated with them. And then staying healthy, the MnCHOICES assessment with the staying healthy section and support plan, and then all other questions at the end. We are at about 1:45. So let's go ahead and start with health risk assessment, and then I'll give you kind of the kind of how long we'll stay on each depending on how many questions we have. But again, this is the general organization for questions today. If we could start with health risk assessment with an associated support plan first, that would be great. And then I will try to pay attention to time to make sure we get a chance to get to everyone. And if there aren't a lot of questions about one of these, we'll move to the next and we'll keep going down the list. So let's go ahead and start with health risk assessment, HRA with associated support plan first, please.
Teresa, it looks like Linnea has her hand raised. So Linnea, I will go ahead and unmute your line.
Can you hear me?
We can.
Hi, my name's Linnea. I'm a care coordinator with Access, and we're a delegate for both Medica and UCare. And first of all, thank you for hosting this call-in that's specific to MCOs. It's really helpful to have a smaller, more focused subject matter here today. So the questions that I wanted to bring forward are wondering about some capacity to change a few of the required fields in the HRA to optional fields. The ones that I'm wondering about are within the contacts section. oftentimes with either emergency contacts or people that are part of the member's care team. We might know their phone number, but not their address, their county, and we're finding that as we start to practice in MnCHOICES, not knowing this information is holding us up. So I'm wondering if there's any capacity to make the phone number required, but the address optional.
So we are aware that that is currently something that folks would like. Um, we can add it if it hasn't been added to conversation about a future enhancement. And then I'm assuming that you've determined for yourselves what you'll do with that address to complete it. And I don't know, Rakia, if you want to add anything to the direction we've given on address when they don't know it.
Yeah, so I think some of the direction that we've provided when a user care coordinator doesn't know an address, I think we've instructed them to indicate by clicking the box that they live with the person and then writing a note in the comment field that at this time, the address isn't known. But that just kind of gets you, it bypasses you from having to, put in an address if you just indicate that the person lives with the person and then using that comments field to note that the address is unknown.
Okay.
I think that's what we've said as a workaround.
Okay.
But I would need to look at the status. I do believe we've heard from this in the past, and so I don't know what the status is of it, but I know that was listed as something that we were going to take back and possibly consider for a future enhancement to the system.
Okay. And if we are clicking that box as a workaround for now, is that choice going to feed into any documentation later on, especially anything that's provided to the patient? Are they going to get a printout that says this person lives with?
Yeah, in terms of the print.
Yeah.
For the HRA, I don't know if it prints anything there, but I don't know if any of those fields carry over to like the support plan. I would have to take that back and test that one on my own, unless someone else on the line can speak to it.
Okay. Okay, that works for now. We're also noticing that email address for the member is a required field. Many of our members don't have email addresses or don't know their email addresses. So that's another field that if that could be made optional, that would be ideal. But in the meantime, is it okay for us to write something like none@none.com? Is that going to cause any issue?
No, I don't think it will cause any issue if you put in a email that just defaults to nothing. But
Yeah.
I do want to mention that although the email is required, I think it has that asterisk in the person's profile.
Mm-hmm.
And so your completion requirements in the person's profile would show that it's not met, but it shouldn't stop you from doing your work. You should still be able to create an assessment and create a support plan. There's nothing in the person's profile that would stop you from doing your work. I think there's only two fields. I think it's race and ethnicity, where you actually have to have something in those fields in order to complete an assessment and carry on to a support plan. But the completion requirements, like I said in the person's profile, really doesn't, yes, it would be nice to have all those fields completed, but not having an email if the person doesn't have one shouldn't stop you from doing your work.
Okay. And then the other question that I have similarly here is wondering in the preventive screenings area, the date completed is a required field. Is that another thing that could be made optional since members often really don't know that information and we may not have a way to get it quickly and timely?
Yeah, we can take a look at that too. I don't know if Deb or Sue want to speak to if it's required to have a date filled in there. I know it's required for the system, but I mean in terms of MCO practice or protocol, if we made that field optional, I don't know what downstream effect that would cause if dates aren't populated in that field. And I don't know if Deb or Sue want to speak to that.
This is Sue Cavendro. I mean, I think we would have to take back to the MCOs because I think there is some compliance, and I think they had requested that to be a field that had to be completed, because otherwise, if everybody just put yes and didn't have a date, it gets to be a problem. So we'll have to take that back to the MCOs. Because I think it is, Rakia, you alluded to, there might be a downstream compliance reporting, especially with Medicare for that. But as I said, we'll take that back.
Okay. Or even if there's a possibility to select unknown, you know, obviously if we know that answer or could get that answer, we would, you know, gladly put it in there. But to have a way to say we asked the member this question and they didn't know the answer, having that as an option would be helpful. So, okay, that's all my questions for now. Thank you for your time.
Thank you.
Okay, and then our next question comes from Carly. Carly, your line is unmuted.
Everybody hear me?
Yes, we can.
Wonderful, thanks. So I have a couple questions. So the first question we had that our mentors brought up, and I'm a SMBC manager here at UCare. Sorry, I didn't quite introduce myself, but so there are two questions that populate within the support plan after you hit the submit for the first time that don't show up right away. And those are the housing and desire to move and my plan to address safety needs. And then those two questions though aren't printing on the support plan when we go to print and send it to our members.
So can you say the fields again, please? Housing?
Yeah, it's housing and desire to move, and then my plan to address safety needs. Excuse me. And those are both in the About Me section.
Okay, I don't know if I've seen this one before, so I'm going to ask that you send in a ticket so we can take a look at it more closely.
Perfect.
Because
We
it
will do
sounds like
that.
there's two issues you're identifying. You're saying first it doesn't populate, and then it doesn't, and then when it does populate, it doesn't appear on the printout.
Yes, so she's saying it doesn't populate when the plan is in progress, but when it goes to in progress assessment complete, it populates, right?
Yep.
Yep. And that may be intended functionality, but the question really is when it does populate, it isn't printing on the plan.
Correct. And then we've also shown, and this is probably going to be another ticket as well, that phone numbers aren't showing up on the support plan for contacts like emergency care coordinator, doctor. So we can submit a ticket for that too.
Yeah, that sounds great. Go ahead and submit a ticket for those issues, and we'll take a look into those a little further. And I thought I may have seen something about the phone numbers not printing, but I don't know if there was a workaround for that one. I would need to connect with the case management team on that. But if you go ahead and submit a ticket, we'll again look into that more closely.
Great. And then just one more thing I wanted to point out if time allows. So we've been reviewing, we were notified that there is a test kind of member within the MTZ. It is Waverly Smith. And I don't know who created this test, but it possibly maybe want to be relooked at. The goals aren't really written in SMART format. So we're a little hesitant to share this with just the rest of our team to use as a guide. I don't know if that's on purpose and just as an MCO, we should provide that training, but just wanted to throw that out
Yes.
there.
So I know that the intention of those examples wasn't to be a best practice example, right? It
Okay.
was just to help you guys see what does a fully populated plan look like. So that may not feel clear to you, but we just wrote them as a way so you could see, here's what a plan looks like when it's fully populated. Here's what it looks like when it comes over. So, yep, I hear you saying if we share it with people, are they going to think it's the best practice and then try to emulate it?
Just make sure we're clear on that. Thank you so much. That was all I had.
Okay.
Okay, and then our next question comes from Trista. Trista, your line is unmuted.
Bring up the not having our phone number on the support plan also, but so that's already kind of been addressed. But my other question was the phone number that populates for my support plans when it says I can call the following number if I'm unable to reach my case manager care coordinator is the 800 number for UCare MSHO sales customer service line. I'm wondering if it's possible or if we have any control over what number is put there, because it to me would make more sense to have our general number for my department to reach me at or our backup phone number there rather than someone calling into MSHO sales.
Yeah, so that's a great question, and we are actually looking into this. So right now, the system is programmed to pull the organization's number, and so in order to change what populates on that support plan print, it would have to be changed by the lead agency admin. But we do know that there's a downstream effect because if the lead agency admin changes it for for the organization, then it would change for everyone's plans, which we don't want. And so we are actually having conversations about that now, whether we're going to make that number field be editable on the support plan or look at the requirements to see if that number should populate from the location instead of the organization. So we are currently in the process of talking through that as well.
Okay. Yeah, I've noticed. So I spoke with another person within my agency who represents the waiver, and their phone number was our sort of our general backup number. So I'm sure it's different based on what our role is or what our however we're logging in. But yeah, I appreciate you looking into that a little. As I think if someone's if they're frustrated trying to reach their care coordinator, calling a sales line isn't gonna maybe go super great.
Yep, and that makes sense. So
Thank you.
thank you. Okay, and then our next question comes from Mary. Mary, your line is unmuted.
Am I on?
You are, we can hear you.
Hi. I'm a security administrator for an MCO delegate. Sorry if this is not the right time to ask, but I can't stay on for long. We had a fairly new staff member resign, and I went to Terminator according to the notes on the Smart Guide, and I couldn't find her. Now, she hasn't been assigned to UCare member yet in MnCHOICES, but I can't find her at all. So I just wanted to know, do we need to do anything more? Do I need to send a ticket to remove her from the MnCHOICES systems access?
So when you so when you searched for her in the staff member search, she didn't come up.
Correct.
So she shouldn't be in there. I mean, you could. Are you putting in an access ticket for other systems too to make sure she's been removed from them? Because if you do that, they'll remove for they'll check MnCHOICES too.
Oh, okay. I'm not sure who's responsible for doing that here, but I think we just have to notify UCare, and that may have already been done.
Yeah,
So it's
yeah.
my
If
task
you-
is to take care of the MnCHOICES stuff. So my other question is could you really quickly show me how I can see, at the last webinar you showed us how we can see our staff list, and I missed how to do that, and that would be
Yeah.
so helpful if I could do that.
Yeah, I can bring it up. I'll log into MTZ, but I'm just going to repeat what I just said too, so
Mhm.
people understand your question while I'm bringing up MTZ. So the question that was really asked is if someone is no longer in employment with an agency, right? Like, what do you do? So in the instructions, it will have you unassign their roles, like make sure for all of the people that they've been assigned to that they're unassigned, and then unassign their roles and unassign their location from their staff profile, and then put in an access ticket to the Minnesota Service Hub to have them terminated from systems. And then when you do that, then they will also check MnCHOICES. So just to make sure that everyone is on the starting on the same block. Okay, so I'm logging in right now. So I will log in as security admin so that you are seeing it in something that looks more like what you might be seeing. What I do is I always go in through my profile, because when you go in through your own profile, then you can see the organization up here. And when you click on that organization link, it will take you to the organization. And do you see here is the staff member icon?
Oh,
When you
beautiful.
click on that staff member icon, then you will see all the lists of all of your staff, and you can use this search to look for one specific person.
Mhm.
If you see active, that means they're still active in the system. If you see this little line, it means that they're not active, that they've been unlinked from the system, but they'll still show up in the list. So as long as it's this line and not active, they should be good. You should be good to go.
Okay, so when I did that through my profile, I'm getting like every UCare person ever, but
Yep,
not at
yep.
my location. How do I find it just at my location?
So
To be a
instead,
delegate.
you can't search here by location. I was
Okay.
trying it this morning, but you can
Mhm.
search by staff person. So like in this
So
example, I'm in MTZ, right? So
Sure.
so I could look up, I'll
So
look up
so
myself.
what you're saying is I can't get a list of just my staff members at my location.
You have to, no, I am
No.
not aware of a way to do that. We've been playing with it on how to potentially do it.
Sure.
To try to look at it, but like I just looked up myself, so I can look up myself and see, yep, I'm still active.
Okay, okay. So I was hoping that there was a way that I could get a list to see who hasn't been, quick list to see who's, because, we were surprised Clara wasn't there, that kind of thing. So, okay, that helps a little bit. Thank
Yep,
you
and like
very
I said, we're looking at that.
Okay.
We were, like I said, we were playing with it this morning, trying to figure out how could you get from here to there. The other thing we were noticing, and I don't think it's in MTZ, is that there are reports in production, and
Oh.
there's one in there called inactive users, or something about when users log in, so you can see if a person's logged in or not. And so you could try using that too.
Okay, that's very helpful. Thank you.
You're welcome.
All right, and then our next question comes from Don. Don, your line is unmuted.
I have a couple of questions. The DHS 6791A, it's a two-ply MnCHOICES assessment summary worksheet. We're wondering if that's an expectation of MCO care coordinators or if that is specific to fee-for-service. Form is not really clear.
I am wondering if that's one of the questions that can be answered in that LTSS forms
Oh, I can,
list.
this is
Go
Sue.
ahead.
I agree. I think it is answered there. Dawn, no, that is not a document that we have required MCOs and their delegates to use. Because it really is, it's when you're passing information along from an assessor when a case manager has not yet been assigned. And because our model has, the case manager, care coordinator, and assessor role combined, it has not been a requirement.
Awesome. When we were looking at the form, that was like an
Yep.
assumption we made, but we just wanted to clarify because it
Yep.
looks like it might be more of a summary for the member. So we were, what if this, what if that? So that's a really helpful clarification.
Right. And so if you think about it, it's, you've had an assessment and you don't have a case manager yet. And so the assessor, it's also known as the leave behind document, because if you notice it, like you said, it's 3-part, that it's left with the member when there isn't a case manager yet assigned in the fee-for-service system. So thank you for asking that question.
Yes, thank you for that clarification. I have another question. I have 2 more questions. Are MCOs required to do MnCHOICES lapsed assessor audits? The last communication I could find was from 2020, and I just wasn't sure if that's something we are required to be monitoring, the certified assessor status of all of our care coordinators.
So,
MSC Plus, of course.
yep. So let's talk about that a little bit. So, we had the audit process in place because we were seeing lapsed assessors completing assessments in the MnCHOICES assessment application, the M&A application. So we started auditing so that we could notify agencies when we were seeing it, so they could make sure that their folks completed their credentials on time. Going forward in the revised MnCHOICES application, if you're lapsed today, it's going to move the assessor to lapsed assessor, and they're not going to be able to assign people to themselves or work in assessments. So if your goal is to make sure you don't have a work stoppage, you may want to use the report in production that lists the certified assessors, so that you're aware if there's anybody coming up with lapse, so that you can make sure that they are aware that they need to get their information done in time. In addition, we've added pieces to the certification training to say, hey, please make sure you get this done ahead of time. Specifically, so this is clear to everyone and everyone understands it, is when they create their certification for the first time, they create their certificate, that piece of paper that says, or that PDF that says, here's their name, Lori Miller's signature from DHS, and then your signature as a supervisor. Once that document is created, that data goes to the credentials database, and then the next morning it's loaded into MnCHOICES. The same is true for recertification. Until that certificate is created, the data is not populating into the database. So your folks need to make sure that when they do their recertification and their certification both, that they generate their certificate. If they don't do that, the system will not update their dates and it will potentially show them lapsed. And so we built it into the revised MnCHOICES application to ensure the statute is met. So you have to be a recently certified or recertified assessor to be able to do assessor work in the system, and the system will move people to lapsed if they don't meet those requirements.
Fantastic. And that also, so they will be unable to do MnCHOICES assessments, but in theory, they could do an HRA even though they're not supposed to, because they're supposed to.
Well, they could do an HRA because they don't have to be a certified assessor to do an HRA. They just need to be a care coordinator, right? So
Well,
they could do that.
technically, all MSHO MSC Plus care coordinators, unless they're a nurse practitioner working with members in a nursing facility, have to be certified assessors, right? That's what statute and contracting is. But also, I can see the technical part.
Right. So from the functionality of the system, it will only shut off their ability to do work as a lapsed assessor. If you've given them the role case manager for some reason, they could do work associated with it, but they should be able to do, if they have their care coordinator role, they should be able to still do HRA and support planning work. So
Awesome. That's good to know. And lastly, again, a question about fee for service versus MCOs. The MnCHOICES assessment summary, is that required to be sent to members that are on an MCO, or is that also fee for service?
I'm waiting for policy to
Yeah, this is
contemplate and give you an answer. Yep.
I think that one is required. Is that your understanding, Deb or Sue? The assessment summary, which is just the summary of the assessment. You populate it from the printout that it just gets mailed to the person along with your other documents.
Right. Right. The assessment summary is now used, and it's exactly as you said, that it's a document that is printed out and provided to the member. And it's just simply a summary of the assessment.
Awesome. I think that's all my questions for now. Thank you so much for talking me through those.
And just so people are aware, that's sometimes you'll see it referenced as the CSP or the Community Support Plan. That's the old name in the current MnCHOICES system. But it really isn't a support plan. So there was a request to rename that document when we revised MnCHOICES. And so that is why it's called the assessment summary, because that's really what it is. But sometimes people may refer to it as a CSP just to connect those two. But it really isn't a support plan. It is an assessment summary. We've had that question, so I thought I'd clarify that for everybody.
Yep. And then our next question comes from Linnea.
Hi, can you hear me?
We can.
All right, great. Thank you. Just a couple more questions that I found in my notes here. So when we are starting a new HRA, it asks for the health plan enrollment date, and we don't always have that date. So should we be using the date that the member was enrolled in the health plan and trying to find that somehow if we don't have it by default? Or should we be using the date that the person was enrolled with us as a delegate?
So, Rakia, is that covered in the practice guide for health risk assessment in the help center? I can't remember.
It might be. So you're referring to the enrollment date?
Right.
Did you say you were a delegate or you're an MCO?
Yep, I'm a delegate.
Okay, I think when we've gotten this question, and I'm going to ask Deb or Sue to correct me if I'm wrong, but that date, I think we've referred your delegate agency to confirm what date you should enter there with the MCO, just so that it's consistent.
Okay, so we
how
should
you're
ask that
using that
directly
date
to our
field.
MCOs. Okay.
Yeah.
Okay.
Yeah, I don't know if, Sue, you want to say more to it, or if there's a difference between what we might have in guidance or what if the MCO might have something different.
That's exactly how I was going to respond. You're absolutely correct. Yep.
And our agency is contracted with 2 different MCOs. One of us provides us with that enrollment date on our monthly reports and the other does not. So we might need to figure out a way for them to start getting that to us.
That would be a good place to start the conversation.
Okay.
Yeah, and I don't see in the practice guide that it gives any specific direction, just to clarify. I just went.
Okay. And then other question, do product changes and transfer HRAs still need to get entered into MMIS, or is there a process that should be followed in MnCHOICES when someone has a product change, like switching from an SMBC plan to an integrated plan, or when they transfer from one delegate to another? Do you have any guidance on how we handle MnCHOICES entry for those situations?
We've been working with the MCOs on that. There is a transitional HRA in MnCHOICES, and so the intent is to be able to record those within MnCHOICES. You mentioned something about MMIS. Remember, if anything is being done within MnCHOICES, you don't enter anything into MMIS.
Correct.
Regarding an HRA. So I just wanted to say nothing gets entered into MMIS if you are doing the work in MnCHOICES. We're actually currently working with the MCOs on some instructions for that. So I think there'll be something forthcoming. But the answer is yes, that the work will be done within MnCHOICES.
Okay. And so we would use a transitional HRA form both for those product changes within the same plan and for delegate to delegate transfer situation?
Yes.
Okay. Thank you. That's all I have for now.
Okay, the next question comes from Dorothy. Dorothy, I have unmuted your line.
Oh, I'm sorry.
We can hear you now.
Okay, thanks. Can we load legacy documents into MnCHOICES now?
Dorothy, who are you, a delegate or a lead agent?
We're a delegate.
So you're wanting to load legacy documents, so you want to attach them to a person record is what you're saying?
Right. Their prior HRA and health plan or care plan.
So when you say legacy, you're referring to the eDocs that's currently being used for the HRA?
Yes.
Yeah, I don't know if we have a certain expectation on whether or not you're required to. But I think you have the ability to load any attachments to the person's record if you choose.
Yeah, what I didn't know, Rakia, is if the MCOs had any direction on that. If that's where the direction should come from.
Yeah, I don't think DHS has given any direction on that. So yeah, you can definitely consult with your MCO if they have an expectation to have the legacy documents uploaded to the person's profile or not.
Because otherwise you're potentially wanting them there just so for reference for yourself when you're working with that person.
Right. Thank you. I'll reach out to them.
Yeah, sorry, we don't have more we can say about that.
Thank you.
Yep.
Okay, so the next question comes from Tiffany. Tiffany, your line is unmuted.
You may have yourself double muted, Tiffany.
Oh, and I see Tiffany just took her hand down.
Okay.
So then the next question comes from Sophia. Sophia, I am unmuting your line.
I am a delegate for Medica for MCO, and my question is with care plans. So when we complete a care plan in MnCHOICES and we have to update that document throughout the year, do we not say that it's completed, or how do we handle that so that we can update it throughout the year?
Well, I think you would still update your plan and close it out because the person should receive a copy of that plan, right? The support plan. But I think if you have to make updates on it throughout the year, that you would use the revised functionality. So once you've closed out your support plan or it's in that completed status, you'll go back to the person's forms and then you'll filter use that filter option with the forms, and then you'll select the support plan to revise it. And revising it just kind of makes a copy of the support plan so you can update it or add any edits to it. So in this instance, you'll still close it out and then just use the revised functionality to make any updates or edits.
Okay, and then we would just keep doing that until it's final. after 365 days.
Yes, and so, yeah, I mean, I don't know. I mean, I can't speak to how many updates are normally made throughout the year on a support plan, but the idea is that if updates need to be made, then you'll use that revised functionality.
Does it,
And it's,
does it, I'm sorry, go ahead.
no, you can go ahead. Someone was
Does it
just
keep,
asking if we can demo it, and I just wanted to see if Teresa had the system
Yep.
up, but I see she does have it up.
does
Yep,
it
so
keep
I'll
making
show.
copies, or does it just one copy in there? I mean, will it show multiple times, or it'll just be the one care plan?
Let's
No,
try
it would.
it.
I think it would create a new one.
I
don't
think
think
so
it.
too.
I think it would create a new one. It would create a copy of what, so it would show 2 support plans in the person's record with different dates. The created by date would be different, but Teresa has it up and she can show us.
Yep. So I've just picked my Carla Herring in MTZ because she's got all kinds of stuff I've done in her record to try all different things for training. So please disregard her messiness. She'll make no sense to anyone who's doing real work, but she works for what we need to do with her with. So I have a plan right here. So first thing I did is I used the filter. Sorry, I'm going to back up and do that again so you can see it. I'll go to her dashboard and then come back to it. I went too fast. So I used this filter up here and I picked support plan. And then when I did it, it only shows the support plans. You can see here the plan that's approved. I'm wondering if I'm going to be able to do it because I see I have another plan out, but we'll try it anyways. When I click on the ellipsis, I can see revise. Whoops, sorry about that. I clicked too fast. I'll put plan revision. I'm just going to put change in condition, okay? So again, please know that I am not a practitioner. Our signature is required, yes. If there's a change, we'll put the start date, August the 1st. We'll put the end date. I'm just going to make something up, 9/30/2023. And here it has the previous date range. Ooh, I wonder if it's going to have an issue with that. Let's see. Does a person apply for moving home? No. There's no support plan type. We'll do you want me to do MnCHOICES assessment MCO?
No, we don't do MnCHOICES
Oh,
assessments.
sorry. I know, but it might be, I don't know
Oh.
what this one's put at. It would be whatever I had it at originally. Let's see if it'll let us do this. Yeah, so I've got one in progress, so it won't let me. But then what it will do is it will open it back up. It'll copy the data over, and then you'll make any revision you need to make. But like I said, you can see here, I have one open. So it's like, hey, you can't have one open and revise one. So it won't let me, but that would be what you would do is you would revise it.
Okay, and I just had a couple more questions. So when we print out the care plan to send to the member, along with other documents, is there any issues or legality if we want to upload it into a different medical record? Like we have Epic that we also use. So would we be able to upload or print off the care plan from MnCHOICES and send it to our Epic HIM people to upload into the patient's chart that is not MnCHOICES?
I'm letting policy folks have a chance to discuss and think a minute here. So sometimes they're silenced because they're digesting what you said, determining how to answer it best.
Yeah, and I guess I'm gonna call out on Deb or Sue and see if you have any thoughts on that, or if that's one that they would need to consult as an agency to determine what gets uploaded into their systems, or if it's required, or I don't know if you have any thoughts on that.
So the question is what gets uploaded into.
It's May
Their
Yeah.
systems like Epic, if they're using Epic.
Yeah, that would be a MCO directed.
I think the question was, is there any concerns that we would have HIPAA or otherwise to do that?
Yeah, the MCO, that would be directed by the MCO in their contract, but that's why I think it all of that would be directed by the MCO. They're responsible for maintaining that.
But for DHS, there's no concerns. There's no like legality or copyright issues or anything if the form
No,
was
I don't
filled
believe
out.
there's
Okay.
copyright information as far as HIPAA and you know, we have this, we're all a part of the same, they use the word welfare system, which is an antiquated system. But, you know, and that, you know, that's why we have everybody doing security training that's the same and that kind of thing. But as far as if you're talking about copyright information, I don't believe so. But anybody else from DHS know of any copyright information? You know, because it's the data that you've entered, and there's, you know, that's the person's data. I can't think of anything with that, but once again, it's, you know, if you're talking about legality, you should be talking to the MCO and they would be giving direction on that.
Okay. So, all right.
Yeah.
I think that's all the questions I have. Otherwise, it sounds like I'll just send them to my MCO and either they'll answer them or get a hold of someone at DHS. Thank you.
Thank you. Okay, so we're going to move on to, and Teresa, before I unmute Emily's line, I think we have a few questions, and if we're moving towards all other questions, or if we're still on the HRA, are we opening it up?
So I've been watching the time.
Okay.
I'm thinking that we would go to staying healthy and the MnCHOICES assessment MCO questions. And so what I have is potentially staying on those till 10:50 and then all other questions from 10:50 to till we close. Then we can just leave it, have it be open. If there aren't any other questions, of course, we would move on. So I just have this little chart I created for myself so I could pay attention to time.
Okay, sounds good. Okay, so then the next question actually comes from Tiffany. Tiffany, I'm going to unmute your line.
Hi, are you guys able to hear me?
We can.
Lovely. Okay. So I am a support staff for an MCO delegate agency. I take the assessments from MnCHOICES and enter them into MMIS for our care coordinators. First, I realized that those 3428Hs don't go into MMIS when they're completed in MnCHOICES. Once I entered that assessment at MMIS, I was unable to change the assessment status in MnCHOICES, and I'm wondering if anyone else is in a support staff role experiencing that, and if there are any kind of workarounds for that, so that support staff who are entering the assessment in MMIS can change the status in MnCHOICES once approved.
So you're saying for the MnCHOICES assessment in the revised MnCHOICES application, it's in another status besides MMIS approved, and you want to move it to MMIS approved.
Correct.
Okay. And your role is support staff, is that what you're saying?
Yes.
I think it's the only one that you can't do. I think it's set for the certified assessor to finish closing out.
Okay.
Yeah, so I think currently that would be the workaround, is that you will have to reach out to the certified assessor.
Yeah, because it's their document and they're verifying, yep, it's done, it's closed, it's all finished. So
Makes sense. Thank you so much.
yep.
Okay, so then our next question comes from Ruth.
Okay, I have a couple of questions. I work with fee for service and MCO members. So you had talked earlier about when you go in and you have to pick your name for the assignment and try to figure out which one you're supposed to use. Do they always and, do they always stay in the same order? So if I figure out that the first one, the top one is fee for service, the second is an MCO, this third is another MCO, or will they not necessarily be in the same order? Do you know what I mean?
Yeah, I totally know what you mean. And if you could see me, I'm shaking my head and smiling at the same time. I am not aware that they stay in the same order.
Okay.
So that is what I've heard people reporting. So that's all I can speak to.
Okay. That's nice to know because I
Right.
think I ran into that problem. I mean, where I put
Yeah.
one and I thought I was, and then I couldn't do all my things. Anyway, okay. The other question I have has to do, you had mentioned that there's a transitional HRA in MnCHOICES revision. Is that different than like the HRA that would be completed for somebody that's an SNBC member? Are there two different HRAs?
So your question is, when would you use a transitional HRA? Kind of like, what's its purpose?
Well, I know what I mean, because I guess I know when I would use it because I have outside of, with an MCO outside the revision. But I was just wondering, so are there two different HRAs in the MnCHOICES revision? One that like the SNBC care coordinators would use, and one that you would use, so are there two different HRAs or are they all the same thing and you can use it for both ways?
Yeah, so the HRA in the system is just the same HRA. There's only one HRA option.
Mm-hmm.
So, Teresa, do you still have the system up by chance?
I do still have the system up. And so what you were thinking of is speaking specifically to the support plan, correct?
No, I think we're talking about the HRA.
I'm talking
Yeah,
about,
I know.
yeah.
Okay. Yep.
Yeah.
So what would
So
you like me to do?
Can you go and just search for, just in the search, just put transitional?
Up here?
Yeah, just search for a person transitional. I think I have one.
Oh, I probably spelled it horrible. I did. I spelled it horrible. No, I didn't. Transitional. Oh, it's because I got staff person on. Sorry.
Oh, yeah.
Okay.
There you go. So click that. So if you go to your forms, so when you create a new form, you're still selecting the HRA MCO. So it's still under the same health risk assessment. But if you click your edit toggles, Teresa, and if you go to the assessment information tab,
Yep.
and scroll down a little bit to the HRA type, that's where
Right
you're
here.
just, yeah, that's where you're just entering that it's a transitional HRA versus an initial or an annual. And so the assessment information would remain the same, but the transitional HRA really just has you checking still the same sections or domains to indicate if anything has changed or if there's anything different once you've gotten that transfer.
Okay.
So to answer your question, the assessment is still, it's the same. There's not two different. You're just indicating that this health risk assessment is a transitional HRA. And then your requirements would be different. I think your completion requirements would just be to indicate that you reviewed each of the domains and made the necessary updates.
Okay.
If that makes sense.
Yeah, I mean, because currently one of the health plans that I work with has a transitional HRA form that they have used, prior to the revision. And one does not, we just review whatever, we review information. But there's not an actual transitional HRA form. So I was just curious. So I think we're going to have to address that question of how those particular MCOs want to address a transitional HRA. Because I think it might be different between the two MCOs.
MCOs, right? Yep. And we would advise that you would consult with them.
Yeah, because I guess I wasn't. Yeah, I guess I wasn't aware that there was that where you could market transitional HRA in the revision. So, okay, thank you so much.
Yep, no problem. Okay, and then our next question is from Michelle.
One question. Am I muted? Can you hear me?
We can hear you. We can hear you. Go for it.
If a care coordinator completes a support plan on a disability waiver person and submits it, does the disability waiver case manager have the ability to work in that plan or add to that plan, or is theirs totally separate and neither of them have access to each other's? Does that make sense?
Yeah, it makes sense. I think what you're hearing them do is thinking about the fact that you have two support plans for two specific reasons, documenting two specific instances. So I'm just letting them talk amongst themselves, as well as they may come back to you and say, I need to do some more follow-up. So we'll just give them a moment to have a conversation as policy.
Yeah, and I know in the system, and maybe this is, I'm going to ask Teresa to help me with this, but in the system, anyone can search for a person, right, if they know the name of the person or PMI.
Yep.
But I don't know if they have to be assigned to the person in order to make any edits or updates to a plan.
If they have the same role, they may be able to update plans. Where I would be cautious is here, which is why I was asking you from a policy standpoint. We know that you guys have said, right, as policy that a DD support plan with a MnCHOICES assessment is done, then a support plan is done with the HRA, and that they're done separately of each other. And so the question would be, why would there need to be a change? Why would the care coordinator need to make a change to the case manager? Why not instead message the case manager and say, hey, I was reviewing your information and I thought you might want to know this, and add it to your plan, so that it becomes communication versus working in each other's stuff, just kind of like out of courtesy is how I've been thinking about it. So that way you're both aware of what each other needs to know and you're documenting what you need to know, but you're not speaking to the disability waiver or the HRA.
Darren does it in the MnCHOICES system.
Yeah, in the system. So that's how I think about it. Yep. Because you can always use messages, right? You know who that person is. You can look at that person, see who's been assigned to them, and then just go ahead and message that person and say, hey, I see that this information isn't in your document. I'm not sure you know it. And then they could say to you, yeah, I can see this information isn't in your document and you might want to know it. And that way you're coordinating with each other.
Teresa, this is Sue. Thanks for saying that. And I think that is exactly what we're all going to be learning, is that there's new opportunities to see and communicate now that people are all in the system. And so these are Teresa gave a great example about you can send a message saying, oh, I see this, and I don't know, you may want to note this, and because everybody can see everything, it's more about communication than it is about actually needing to go in and make that change. You can communicate about, oh, did you see this, or are you aware of this, and vice versa. So I think we're all going to learn that there's going to be some opportunities for communicating better now that everybody's kind of in the same system together. And I think that's what you were asking about, right? And Teresa.
I think
Yeah.
she's on mute already. So
Okay.
yep.
And yeah, and Teresa, yes, thank you for showing that messages, because I think that's exactly a good thing to show. Thank you.
Okay, so then our next question comes from Emily. Emily, your line is unmuted.
Hi, everybody.
Hi, Emily.
I have a quick clarification from a previous question about the enrollment date that we should be entering into the system. Should we be picking or finding the original enrollment date when somebody first started with the MCO? Or are we picking the enrollment date of when they started their current product? Like if somebody transfers from SNBC to integrated or something like that, are we saying that we want the original enrollment date with MCO as a whole, or enrollment in that product?
I'm thinking that you heard policy say to check with the MCO about what date they want you to use.
Okay, let the MCO decide.
I think that's right. Am I hearing? Is that right,
Correct.
Sue, Deb?
It's like how they might be using that date as far as audit processes. Correct.
Okay, we'll just check then at that level. A few other pieces. Could we talk a little bit about the self HRA, or like the mail out HRA? I do know that it's been put in the help center. I believe that the TrainLink trainings at some point mentioned that once you receive it back, if you get it back within 60 days, you're supposed to actually enter it into the system. Is that correct?
So you're speaking to this?
Correct. So I understand when we would mail that out. And historically, with anything that we've mailed, we just mailed it. If we got it back for our records, that's great. Typically we don't, but sometimes we do. But I am fairly sure that some of the TrainLink data mentioned entering it into.
Yeah, you would need to
MnCHOICES.
enter. You need to enter. This is soon. You need to enter an HRA in the system, and if you get it back by mail and you fill it out, otherwise it's going to look like you didn't do an HRA. So then you would need to do a refusal or unable to locate or something. You need to put something in the system to track.
Yeah. So typically when we end up mailing one out, it's because we've like already entered ongoing no contact or a refusal. And so I think maybe my confusion was about entering, if somebody does send back the mailed version, is that the content we need to enter? Or if we already entered a refusal or an ongoing no contact, and then we get that back later.
If you entered in as a refusal or unable to locate, but then they actually fill it out and send it back in, you need to review that information. In order to enter it, you might have to contact the person because there's some fields that don't equate directly to a mailed out version, if you notice.
Right, that was gonna be my question.
Yeah, so you should be able to, you do need to, take that and do something with it. Otherwise, they're going to look like they're unable to locate, or you didn't, or they refused, which is not accurate.
So you're saying, Sue, that they would have to update MMIS?
Yeah, no, not MMIS. They would put it in MnCHOICES.
Okay.
Yeah.
But I don't know if the mailed version would meet all the completion requirements.
No, that's why we've said, I believe in the thing, is that this is the person sent this back, that you might need to follow up with the person. In fact, you probably do. And you probably should follow up, because there's probably things on that like oh, you're seeing something and you need to talk to them about it. It's a good practice just to follow up with a person. They sent you information in, follow up with the person.
Yeah, and we certainly are trying
Yep.
to reach our members. There are definitely times when we will try to reach them, we're unable to. We mail them the mail version. They do surprisingly send that back, which is great, gives us more information than we had originally, but we still aren't ever really able to communicate with them. So then if we've already entered the refusal, the ongoing no contact, then they send back the mail version, but we're not able to get all of the completion requirements into the system to enter a whole new HRA. That's the part where I'm a little bit stuck. So
Well, that's what
historically,
I said. It could be many different variations of that. But you're right. Somebody could fill it, mail it back, and all they put in was their name and address, and
right,
maybe answered a couple of questions. Obviously, that's not a complete HRA.
right,
And so at this point, it's that you haven't filled it out. You continue to get a completed HRA until you get a completed one. If you get a completed one, then you enter that into MMIS. So it might be various stages depending on what you receive back. But you're correct that in order to enter an HRA, it has to be complete HRA. You can't enter a partial HRA.
right.
You
Because it wouldn't
could,
meet the
but you
completion
can't complete it.
requirements.
Correct.
Right. Okay. So, sorry, I'm just processing right now in my brain. Okay. Okay, I think I'm good with that for now. Another question about, and this may end up being a more like need to talk to MCO about it, but currently in Legacy, there is if somebody is a refusal, but they are on the integrated SNBC plan, there is a specific refusal care plan. Is that something that we are able to do in MnCHOICES right now, or seemingly not? Would that need to stay in Legacy for now?
So the MnCHOICES system will allow you to complete a support plan if a person refuses.
Okay, do we know if it meets all of the CMS requirements of that enhanced refusal care plan?
In terms of requirements, I don't know what specific requirements you are referring to, but we are in the process of looking at the refusal support plans. And last month in July, we've actually had each of the MCOs send us kind of what their process is for creating refusal support plans. If a person refuses an assessment, do they still create goals? Do they enter any services? And so we've collected all of that information from the MCOs during the July Care Coordinator meeting, and we've consolidated all of what they've provided, and we do plan to bring that back to the Care Coordinator meeting on Monday to kind of talk through how or what information goes into that refusal support plan. So that is also another thing that we are currently working on.
Awesome, that answers that question then, thank you. And then my other questions all really revolve around the HRA support plan, and I'm wondering if maybe we could look together at so some of the pieces, like when it asks about waiver providers, coming from a care coordinator lens, we're struggling a little bit about how to efficiently find the right services or providers that a person has, because all of it feels very case management-y or full MnCHOICES assessment like. And we're used to historically just listing it all like on a Word document or something like that. It's just, well, these are the waiver services they say they have. And so searching for those waiver providers is causing a little bit of difficulty because of how much data is in the system. I'm wondering if we could look at that.
So, Rakia, what I wonder about, and we're gonna just talk out loud for a second on this one, is where the planning gets done for listing the services in a support plan for, I'll say an HRA versus a support plan for the MnCHOICES assessment for a waiver. And so like how the documentation is different. So the services that support me versus maybe another option. I think that's where she's might be getting, I don't know. And so I'm just wondering
Yeah.
how you would like me to get there.
So I think in our training modules, we've indicated that for an HRA, that you wouldn't use the waiver provider section.
Right.
And you can search for, Teresa, if you want to search for just health risk. I think I have a person that has.
Okay. Hang on,
So
I think
yeah, health risk, if you want to search. Right now, we are aware that there's an issue with the HRA support plan where because HRA isn't listed as a program type, currently we're not able to link waiver providers to an HRA support plan. And so I believe in our training, we've indicated that you would have to use the services and supports, and Teresa's going to go there, do health risk in one word, one together.
Yep, I'll do. Yep, that's exactly what I was speaking to. So thank you.
Okay,
Yep,
so we
so
would
if you
list
go to
all
the
under
support plan,
Services.
and you go down to the services and support. So if you add a service or support, this is what we've instructed, or I guess you could click on one of those that I already have created, or go and create a new one. Just do add new.
Okay.
Or add service or support.
Yep.
And so if you pick services that support me, and then in the search field, to populate the list of HRA services, you'll need to click search and then type in other. And when you type in other, it'll populate a list of services that could be entered into the HRA support plan. And then if you click one of those services, I think it's a list of 43, it looks like, services to choose from, you'll link it to the support plan. And then in the contact information, that's where you would indicate, you know, who's providing that service. You can enter any details there in that contact information field. And then that will populate in the person's support plan.
Gotcha. Yes, that is absolutely clearing up my confusion. So we will skip the waiver provider section for now, put it all under services and supports.
Yeah.
Okay. Thank you. This is the exact visual I needed.
Yeah, and there may be some others that where you can't find the service.
Right.
Do you speak to that one then too, what they do? Rakia? So if they search for other and it's not in the 43?
Yes.
So isn't there an other? They pick other.
Yep. Then there's an other. Yep.
Oh, so one of the 43 is also an other. Okay.
Yeah. Yes. Yeah. So if you go
other, I like it.
Search for other, you'll see another option is other, and then you can enter that the information in that contact information field. Now there is something that we are currently working on, so that HRA would populate as a program type, and then when you select HRA as a program type, then it will list those services, but that's something that we are still internally working on to get that HRA added as a program type, so then you wouldn't have to search for other.
Gotcha. Okay.
And this is in the current functionality document, so if you wanted to go back and reference it, it should be listed there.
Perfect. So then long term, is that waiver provider section eventually going to go away, or once some of the other stuff with the plan type, will that then work? I guess I'm just not clear what the waiver provider section is then for. If it's just not working currently because of some current functionality, or if it will go away in the future.
So really what you're hoping for is that so folks know that it would just be hidden so that they know that not to use it. But it is kind of the standard template for the support plan, so that's why you see it.
Yeah, and I think this was something that waiver providers, because I mean we have this listed for the other support plan options as well, and this is kind of the out of the box product that we're working on. So
you just have to know not to use it.
Gotcha. Okay, that's fair. That's fair. And then when we're wrapping up a support plan, there's a question in the signatures section about appeal rights. And I know it's been mentioned at a webinar before, what exactly we're supposed to be mailing, and I was not able to find that information again to remind myself. So for waiver side of things and my case management side of my work, I understand what that all looks like. But for an HRA support plan, my appeal rights were shared with me. What exactly are we supposed to be sending them?
Yeah, I'm going to ask Deb or Sue, do you know what the process would be for an HRA and what gets mailed?
Is that an MCO question?
Because we looked at all of our MCO like leave behind documents that we send for legacy stuff, and none of them seem to say appeal rights.
So where does it say that? Does it say
Yeah,
that
I was
on
just
the
going to look at
support
that
plan?
too. Is it in the, where is the appeal rights language?
Right on the page.
So, yeah, so what I see in
signature.
the LTSS instructions are appeal rights, yes, by counties and tribal nations for that one. But it seems like I remember we've had conversation about they would send.
I'm just wondering where it states that in the
Yeah,
HRA.
in the system.
It's in the support plan, not the HRA.
Am I
So
in
you're,
the
Is it the HRA support plan or
Yes.
the regular support plan? That's what I
HRA
mean.
support. Oh, I'm
So
sorry.
I'm
Yes,
I'm
HRA
in
support plan.
right now. I'm in health risk assessment SNBC HRA support plan in the signature sheet section. Is it in the signature section farther below?
Yeah.
So sorry, I'm trying to
It's
get
okay.
us
We
there.
had it for a second and then something.
Well,
Can you
maybe it
click
was
on
in the one above it. Yep.
Yeah,
Yep.
that
You're
one.
welcome.
The second
The
drop
appeal
down.
rights were shared with me. Or managed care form is what it says.
Yeah.
So
Oh, but you just can just say no because
Okay,
if
so
it's
it's
not
okay to say
required.
okay. Okay, so we'll just say no to that.
I think it
for
just depends
HRA.
on which services, if there was anything and it's directed on what the MCO instructed you, but you can say no if it's not a something that appeal rights are required.
Okay.
Because I
and
think there's a yes or no, it's an option, right?
Yeah.
Yeah,
Well,
it just
and
feels weird to say no to it, but I can check with our MCO directly.
Right.
Right.
And
Okay.
if for some reason that were, if you felt like they might give you instructions on what to put after it or something too.
Yeah. Yeah, and I know there's other leave behind documents that we do give them that have a bunch of other info that we're going to type in that other info section. But that's good to know. Last question, with the signature pages as well. If we're doing a handwritten signature, can you remind me which signature page DHS would like us to use, or is that an MCO specific question as well for now? If we're doing handwritten, not electronic signature. Because for example, the like CSSP signature page for waiver folks is not a thing for MCOs for HRA support plans. So would we just talk to our delegate about, or talk to our MCO about what we should use for handwritten signature?
And in this
Hi,
case, are
this
you
is
talking?
Kathy.
Yep. Thank you, Kathy.
Yeah, no problem. So wouldn't you print out the support plan from the system and have them sign that on the signature page for handwritten?
But I don't think we can print it when we go to our HRA, which was when we would be seeing people, right?
So you're speaking specifically to the HRA, not the MnCHOICES assessment application.
Yes, correct. HRA support plan.
And you're not able to print it because you did the support plan when you were out in the field, or?
Right, because we do one visit where we complete the HRA with them, get the support planning questions asked. So I guess we haven't tried seeing if we could print the signature page ahead of time without anything filled out. I hadn't thought of that.
And then you could scan it back in.
Okay.
And am I right, folks, that they can attach then that signature to inside the support plan? Or is
Yeah,
that
it does ask if you've got a handwritten one, it
Yes.
gives you an option for loading one, but I just wasn't sure what we should be using for the handwritten signature page.
So I think what you are hearing is if you could print the one in the system collect the signature and then upload it.
Okay. So
have you tried taking and so are you saying too that, have you tried using the forms offline?
we did the HRA offline, but we can't, at the time, I don't think we could have the HRA and the support plan both offline because that was either a recent fix or still being fixed. I can't remember. Because we do the HRA and the support planning all in one visit, we're not doing 2 visits. And so we needed the HRA offline. So we didn't try.
You can have multiple, you should be able to have multiple forms offline.
Yeah,
So
I think that was a recent fix, if I'm remembering correctly.
Okay. If that's not working, I don't know, Rakia, if
and just in general, to be honest, we just didn't even try to do the electronic signature yet because doing the HRA and offline mode seemed like enough technology to be trying to do for the first time. And so
yeah,
we were just gonna do paper signatures until we got our feet under ourselves a little bit better. And I know some other call-ins, people have been expressing that having members sign just right on the trackpad has just been a little bit of an accessibility concern. So having paper signatures is always helpful as well, just in case the person isn't capable of electronically signing on the trackpad.
right.
So in this page that we're looking at, is this where we would be able to hit print and it would print a paper signature page for us to take with?
Yeah, and Teresa's going to show you how to print it. We are working on a blank signature page also, but that's coming down the.
Yeah, that's
So
okay.
you should be able, you should be able to remove select all and then
just
signatures.
signature.
Yeah. Our hope is that people can use the system as it's designed the majority of the time. And if there is this 1 or 2 off situations, that's why we are designing a new blank signature page. But our hope is that
absolutely, to use the system. Yeah, that makes a lot of sense.
It just would be easier, hopefully, for all of you.
Yeah. Okay, so then that page somewhere has a signature box on it.
It
Well,
has
it's not necessarily a signature box, but you can sign, they can sign right next to where their signature should be.
Okay, that helps. Thank you so much.
Yeah, you're welcome. Thank you.
So Rakia, just so that we're clear, we are at a time where they can basically ask any question that they need to ask so that they get to get those questions asked.
Okay, sounds great. Our next question is from Rebecca.
Hi, how are you?
We're fine, thank you.
Great. Just a couple questions. I'm going to start with kind of backing up to more of like creating cases and finding our members when we're starting to load people in this new system. Can you just clarify? I know there's like an overnight push, basically once we pull in the information from somebody, and it can take 24 hours, I believe it is. Is that like an overnight, like at midnight, it should update from Swindex, or is it like 24 hours?
So it is a nightly load and it will be sometime in the AM. It's early, midnight, 1 o'clock, something like that. So in the morning when you get back, you should be able to add, or you should see the person there. The reason why you might not see the person there is if you've created a new PMI for that person, and then you may have to go to Maxis, look at the PMI and add the person. So still, if they don't show up, that's probably why.
Okay. Yeah, and typically we're going to be looking, I think, best practice by their PMI, because at an MCO they would typically have that. So, yeah.
Yep. So you don't accidentally create another. Yep.
Yep. We don't want to. Yes, exactly. We don't want to create that. Right. So I think it seems like the best practice. Yeah. And so I guess the question is, I know there's been a little bit delays. It's not always nightly. I'm just wondering, because like I did one in production and it didn't update overnight. I know we've had some that have actually taken like 7 to 10 days. Is that a common occurrence that you're finding, or is that really one-offs? I'm just kind of wondering about that time frame.
So 7 to 10 days is probably about this. So this is a piece that I had to track down for you guys a long time ago and ask a bunch of questions. If a person has been created and they have a new PMI, it only gets loaded once a month. And so your 7 to 10 days is probably because you added them and then the Swindex loaded the PMIs as their monthly load. It appears that that happens somewhere along the first of the month, 7 days about, but I can't get a clear indication on if it's the first Friday of the month. You know, I have not been able to find that answer. I've asked lots of systems people. So that's probably why you're seeing that. What feels like 7 to 10 days is just based on where you're hitting the calendar and when that natural load occurs.
Okay, so is there like something that we can escalate those? I mean, I guess I know that it's more of a system thing for that you've researched, Teresa, but
So
I guess I'm just wondering if we're up against a time frame. Like I'm just thinking about an assessment for cutoff or
so then
something
what
else.
you yeah, so then what you would do for that one is, so as a certified assessor, we'll just use that example. If the person has been loaded into Maxis and they have a PMI and you know it's out there, but you can't see them in the system, then what you can do is you can have INSW access to Maxis so you can read the data and then just create the person and put the PMI in exactly like it is in Maxis. Okay. Then you don't have to wait because you know the PMI has been created. You can create the person. And that's been what we've suggested for you to do, because you are going to have those instances where you have to do it right away.
Yeah, exactly. So typically obviously just wait for it to just do it automatically. So we don't have to go through that process. But then you're asking that we would check in Maxis to make sure there's a PMI and then INWS. Is that what you said?
So you would only do that if, so you've got somebody who you need to do, like basically an emergency assessment, right? They're going from the nursing home to home or someplace, and you need to quick do one tonight. You know that they've been added into Maxis, but you don't know what the PMI is. If you're in that situation, I don't know what the PMI is, but I know they've been added to Maxis. There is a role, it's called the INSW role. You can request it for a certified assessor. Your security admin can request it, or sorry, your security liaison can request it for that staff member, and it just gives them read only. And we've worked on that with the security access team in Maxis, so that you have a way to expedite those when you need to.
Okay, and is that in the is that somewhere in like the help center if we were to search for that process? Just because that sounds very, my coworkers may know what that is, but that sounds very new to me in terms of requesting that.
Yeah, so here's the issue. I by no means am a Maxis access expert, but anybody who does system access requests will know how to request for Maxis and to choose that role. And they will also know that they have to put a business need in it, and they'll know how to do that. So you'll just say to them, my staff need read-only view in Maxis. We're hearing from MnCHOICES that it's, these letters.
Teresa, this is Sue. I just want to clarify that this Maxis conversation only applies to counties.
Thank you.
MCOs do not have access to request anything related to Maxis access. So this would only be with MCOs. And the issue of the PMI, anybody enrolled in managed care, you wouldn't have been enrolled in managed care because you have to be on MA and have a PMI and be enrolled in managed care. So I'm not quite sure why there wouldn't be a PMI for that person, because they would have been on MA for a long period of time, because you get on MA first before you get enrolled in managed care. So
then the question would be, in that instance, they should reach back to their MCO. Sue, is that what you're saying?
Right. If
Thank you.
something is not showing up correctly.
Okay. Well, I am the MCO, so so we have, so I'm the MCO. I know we have PMIs. So I guess then that leads me back to when we are in production and had that 7 to 10 day wait, and then even me overnight just with another patient just now. Are you seeing that length of time as a common occurrence, and what really, because we have a PMI, so if it's not updating and we are up against the time frame, is there like some sort of escalated ticket we should be doing? Because I guess
again,
what caused that delay.
So again, if you have the PMI, you can add the person while the delay occurs in that period of time.
I think the health insurance information isn't pulling in though. That's what updates overnight. Correct?
I can't speak to that. I don't know if it's, you're
Yeah,
connecting
it's
PMI
not
to
adding
health.
the person. Yeah, we're adding the person. We get them in there, we find them, but then there's supposed to be an update overnight with all that health insurance information. The guidance has been if they don't get in there and you've got to like do an assessment really fast, you can do it, and then you have to, you know, recreate it once the information uploads. I guess I'm thinking, is there going to ever be with that amount of days? There's a time crunch. I would
Are
imagine.
you seeing this often, or was this just a?
And that's what I'm asking, if you guys are seeing this often, I guess.
Well,
so
the
the
count
piece,
of the 10 days, but I mean, I
hang,
did
hang, hang on a second.
several days.
I want to back up a minute. I think there's an assumption that PMI and health insurance information are connected. What for the health information when it gets loaded to the person record? I don't know if that is indeed the case. And so, I don't know that we
I
can jump
think
to
that
that
is pulling
conclusion.
from, I think that is supposed to pull.
But if it's pulling from Swindex, it wouldn't have to be necessarily associated with PMI at that point. It would pull any information on health information from
It would
Swindex.
pull, but it
Right.
would pull if the person's enrolled in a health plan. It should pull that.
Right. So I'm just saying, don't tie PMI to it or health insurance information, I believe. I think if you are saying we, you know, the person just got a new PMI, we waited a day and the health insurance information isn't pulling over, that you could potentially put that in and we could double check to see if PMI and health insurance information are that tightly connected. But I wouldn't make that assumption automatically.
That's what Teresa, we're talking. I think that if you're seeing this, it would be helpful to send in a ticket.
Yep, that's where I am too.
Yeah, right.
Okay, yeah, and I know that and we'll maybe just give you some time frames. I know if it's nightly, that's not the typical occurrence. I don't think 10 days is the typical either, but it just feels like a little bit like precarious, you know, when you're up against the wall. And then also, like, can you just explain, and this might just be, maybe I should get at my own training, but where does Swindex come from? Because I guess the other question is, when there's a discrepancy between like last names, you know, we had a member in production that we had a last name, MMIS had that same last name, the county had that same last name. For some reason in MnCHOICES, it flipped that last name to a different last name that was somehow in the past. And the advice was given to contact the financial worker. What should we be doing in that? I mean, I guess it kind of concerns me that if MnCHOICES or that information is the only place that has that other last name and everyone else matches, what would you advise on that for next steps? Is it really to reach out to the financial worker?
Yeah, that was our advice. Yep.
And the financial workers will just
change it in the system.
And will that change then in our, like when it flows into our system, will it change in MMIS and other places then, or will that not match anymore?
No, they will all line up.
Okay, so we can let them know to change it to match whatever it is, change it to match MnCHOICES.
Yep.
Okay. And then can I just go back a little bit? So kind of in assigning as well. So as we know, we can assign, you know, more than one role to a certain, you know, to a patient. And that applies to all like roles, right? So it's like if they have more than one certified assessor, they can also have more than one support person assigned, correct? Okay.
So it may tell you that you can only have one role per person. I can't answer it off the top of my head. Sorry, my brain's still stuck in the last piece.
Pretty convoluted. Yeah, I guess the question would be, we have more than one support staff that may be needing to work in one particular member's case, just like, you know, one member, if they're at an MCO and they're also like on CADI, they're going to have a certified assessor that is clearly like part of the CADI assessment process and needs to be that person. But then we also, as an MCO, need to add both roles of the MCO care coordinator and certified assessor. So I was wondering if that rule kind of applies so that more than one role can be assigned. And I guess along with the certified assessor example, does marking the primary assignment do anything? Like, so if I'm a certified assessor and MCO care coordinator, they have a CADI case manager, they're going to have a CADI certified assessor as well. Should I not mark myself as a primary assignment for the certified assessor then?
Primary assignment is really set to to be used for, it kind of is the indicator for notifications, and currently notifications aren't on the system. So primary shouldn't affect functionality any other places that I am aware of.
Okay,
You
so it's
might be
really that we would
worthwhile
wanna
to
check
it
it,
might
we want to be notified, okay. Yeah,
it
that
might
makes
be
sense.
worthwhile to indicate who's the primary, so if someone else is looking at it, they know who to contact. And then
Yeah,
if the
okay.
question is who's the primary and you don't know, then I wouldn't indicate them.
Okay. So then I guess the other question is, this is more of an enhancement, and I can certainly put in a help desk ticket, but I wanted to make sure I wasn't missing this. When we're assigning as MCO, like I assigned myself, of course, as a certified assessor for, and then also the MCO care coordinator. When I do those assignments for my role, we have to go in and assign first me as the certified assessor and then go back in and add another role to me as the MCO care coordinator. Is there a way that I'm missing on just if I'm in there, can I just assign myself those two roles in one kind of swoop versus having to
Nope,
go in?
it makes you do them separate. Yep.
You have to, there's no way around that.
Nope, there's no way around it.
I don't know if there's another reason, but I guess would that be a possibility of an enhancement? I'm just thinking about support staff that are assigning a tremendous amount of members, of course, at the health plan.
Well, if
MCOs
they're
only
doing,
have to do two roles.
if they're doing it at the person record, and even if they do it at bulk, they're likely to only be able to do one piece at a time. We can put it in, you can put a ticket in and requesting it. It may not be, it may be on the core products functionality, however.
Yeah, I mean, I guess there might be a different way that, or a different reason that they really can't do that. I was just kind of curious, just eliminating a step. And then if we are just looking back at that transfer process, there may be some updated learnings. I know that there's been a new 6037 released, and just wanted to talk again about kind of the process between, let's just say, lead agencies in assignments. So can a patient be assigned more than one location at a time? So if they go from UCare to Health Partners, they can be assigned to both?
Yep.
Okay. So as a new, like, let's say the person is coming to Health Partners, we are going to know that they're coming to us and we're going to assign ourselves as a location. So UCare would still also be assigned, or would that automatically unassign UCare?
You need to go and read the transfer document because it talks about what the handoff and then how to do it when the handoff occurs.
And are you talking about the 6037?
Yeah, it should be in there. They added the instructions in there. And then just to be fair to everyone else's time, I'd like to ask for other questions since I know we're only got about 14 minutes left.
Sure.
Thank
I
you.
can submit tickets. Thanks.
Yep.
Okay, our next question is from Shelley. Shelley, your line is unmuted.
Hi, can you hear me?
We can.
Okay, well, I think you kind of answered some of our questions. It was going back to the signature situation. We're just wanting to know what options we have for care plan signatures as far as compatible external devices. Concerns are handing over our expensive equipment, and then, you know, the person's ability to be able to actually sign on the little mouse pad section, that they're just not able to. And for those that don't have a touch screen option, just wanting to know what options we would have for that.
So Rakia, I'm gonna think about this out loud for a second, and Kathy too, just so you know where I'm headed. So when you collect information from the equipment, is it uploadable? Could you make a PDF of the signature?
Yes, I mean, what we've been doing is actually just printing the care plan signature page and then uploading it. And, you know, with an ink signature.
So, because
we thought if we, yeah, go ahead.
So, because what I was thinking about is this, I'm just thinking for a second, okay, so sorry. So if you had a touchpad that you say currently doesn't work with, or some kind of signature device that doesn't work with MnCHOICES, you can't get it to upload. Could you create a PDF of it and then attach it to the signature page where you can choose the attachment?
Yeah, we just don't know what external device is compatible to even
At
get
the-
to that point, but
But what I'm saying is you wouldn't have to worry about compatibility. You could take the system that you have, as long as
and
it
then
can
just
create a
convert.
PDF of it, convert it to a PDF, and then attach it to the signature and quit worrying about if it's compatible or not. You have what you have, right?
Okay,
I think that's the best solution, but Kathy and Rakia, if I'm not thinking about that correctly and you want to correct anything that I've just said, you're welcome to do so.
I think that's a good answer, Teresa. Thank you.
okay. And then we only had one other quick question. It's regarding the support plan revision. Our question here is, when we going to make a change or a revision to an existing support plan, would we have the start date be the date of the change or revision, or do we want to revert it back to the original support plan date? What would be the best practice? We're thinking to go to the actual date of the change.
Does the SMART guide address it, you guys? With the revision? I'm gonna go look too.
I don't know off the top of my head, Teresa. I would have to look at the SMART guide.
Yeah. Because that's kind of what we would do, right? We would go look at it first to see what it said about it.
Okay, well, we can do that then. And I think just the last comment is we are hearing from at least one of our MCOs that they want us to use the existing care plan signature page because it does meet all the CMS requirements at this time. So that's what we've been instructed, at least for one of the plans. So I don't know if that's for all the others, and if you guys are working on that now, knowing that that's probably coming forward so that the care plan signature pages will meet all those requirements. Sounds like that's a future enhancement, if I heard correctly.
I guess we're gonna have to talk to the MCOs because I am not aware. We designed the support plan to be CMS compliant, so we'll have to take that back to the MCOs. I'm not
Okay,
sure
all right,
what
thank
that's
you.
about. Thanks.
Okay, our next question comes from Casey.
Are you able to hear me?
We can.
Great, thank you. Good morning, everyone. Just one final kind of circle back on that support plan. I'm hearing you loud and clear. Best practice if you need to make an update to your support plan middle of year is to do a support plan revision. My question would be, however, our current practice, as I am calling from a delegate working with multiple MCOs as well as straight EWACs, is to really utilize, specifically for MCOs, the care plan as a working document throughout the year. So updating hospitalizations, any socialization updates, maybe specific family or relationship issue, things like that. So though it might not be best practice, would it be possible to make those updates and keep one revision support plan in progress throughout the year? And to add in our current practice, what we do is we have that working support plan or plan of care is what we call it now. We have that working document at the time when we do our annual reassessment. We then close that plan of care and open up a new one.
I'm guessing they're having a moment to have a conversation about it, and it may be something that they'll have to get back with you on. So
okay.
I'm
No problem.
I'm just quietly filling some time so they can think.
No, I hear you. And maybe I can jump to this one because you might be able to answer this one, Teresa. So,
Sure.
and just to clarify, so the assigning of the roles, again, calling from a delegate, working with multiple MCOs, and just being mindful of what that's going to look like. So currently, when we first did our onboarding, we pulled all of our staff members up. We were able to assign as certified assessors or an MSHO case manager. So am I hearing this correctly? And I apologize for sounding like a broken record. For every time you're to go in and work in a specific, say for Blue Plus, I need to then change my assigned role to a Blue Plus case manager, as well as
So,
then probably log in with a specific
yeah,
login.
what you have to think about, right, is this
Yeah.
the way this application works is it compartmentalizes your work based on who you work for. Okay.
Okay. Yep.
So it puts you in that box right away. It says, here's your box. This is the box you're in. And so when you're working for that person, whether you bulk assign or otherwise, that person has your location that's specific to the organization you're working for on behalf of. And then you'll assign the roles for that staff person specific to that location. So when you do the person assignment care coordinator and you look for yourself, you'll see more than one instance of yourself. You'll make sure that when you pick that instance, that it's for that correct box that you're in. Okay. And so you
Okay.
just need to know, and then you can then just, I know it, when I say just, you guys all go, oh, really? But then you change your location and then you go do your work for your other organization. So, in this instance, let's say you're working for Blue Plus and your county Blue Plus, you put it in and you put choose self. When you're done with Blue Plus, you go do change context. You come here, you do UCare, you pick your county UCare and you do yourself, and then you log in and you do work there. And it's going to keep you very specific to that box so that you don't accidentally work in the wrong place. Right? It's keeping the
Understandable.
documents where they're supposed to be. So I know
Understandable.
that's
Okay.
tricky for people to get their heads around, but it will, that's its, and this agency drop down agency drop down menu is really here to help you remember, right? Like which one am I choosing to work in, so that and then you can always, once you're in, I'm sorry, I'll just stick myself in as admin because it's the first thing on my list. You can always go up here and it'll tell you which one you're working in. So if you
Oh, sure.
forget,
Okay.
right? You've been working
Yep.
along fast and you forget where the heck you are and you're like, why can't I do this? You can go up here and go, oh yeah, that's right. I'm in Blue Plus. Okay, I got to change context and go work in the other one. So.
Got it. And then just to clarify too, for login purposes, like the first time, just behind the scenes, are we going to be receiving any sort of setup details or logins from direct MCOs as a delegate, or no? Essentially, they should be assigning us behind the scenes of MnCHOICES 2.0. So as a delegate, if we're contracted with them, this should be loaded. I can hit my MSHO drop down, county, Medica, person cell, or
So
login cell.
how people are assigned to you as a delegate will be something the MCO will have to give you instructions on. It may be that they give you a whole list of them and then you do it yourselves as part of bulk assignment. It may be that they assign, I don't know what they're doing, and so I can't really speak to their process.
No, that's okay. That just even helps just to put me in the right direction. You know what I mean? No, very helpful. And then back to that signature page, because in our minds we were thinking too. So there are some other requirements for dates when the official date when sent to member. Obviously, that's populating, but also there are some requirements from CMS driven about when we are sending the support plan to the primary care provider. And I apologize if I've overlooked that. We're still really just getting our feet wet and doing this, but is there any date anywhere in there, and that's in that signature page, or anything about date mailed, or maybe that could be an enhancement, because I know that is a requirement, that the support plan is mailed or sent to primary care.
So your question is really about where do you indicate that it's been sent to primary care to
Yeah,
meet
and
the
this sort of
CMS requirement is what I hear you saying.
Yes, and to echo other callers too, because I'm assuming that's maybe why another caller had mentioned, or someone on the call mentioned, that their directive is to continue to use that MCO signature page for the care plan, because there are some elements on there, including person was given the right to receive services in the community or in a facility. So there are certain things on that support plan signature page from the MCOs that is not in the current support plan in MnCHOICES.
And I
So
think,
just to sort of echo on that.
yeah. So I think you heard Sue
Yeah.
say that they're going to go back and have that
There's a circle.
conversation.
Okay, perfect. And I believe that's all I have today. Thank you so much.
Yep. Berkia, before we speak to anyone else, I do want to tell people a couple of things that have been kind of maybe a little difficult for new folks and to help their staff when they're logging in, or if they're having any kind of basic questions along that. We are hearing from some folks that I'm sorry, I'll tell you where I'm going in just a second. I gotta make sure I get to the right place first. Oh, nope, it is help desk. So we're hearing from some folks, I don't know how to clear my cache. I don't know how to do that. You keep telling me clear my cache. I don't know how to clear my cache. The other thing that we're hearing is some people, when they created their MTZ URL, they were able to do it so they don't get stuck waiting for the acknowledge button forever. But they aren't doing it for the production environment because they forgot about it or didn't do it. And so what I just did is I went to MnCHOICES County link and I went to the help desk page, okay? And in the troubleshooting documents, we have this document. We just changed its title to create a web browser bookmark favorite. So if your staff need to know how to do that so that they don't get stuck on that acknowledge button forever and it never goes anywhere, this will tell them how to do it. And in it, it also includes the clear browser cache instructions for both Chrome and Edge. So even if they don't need to do this piece, you could potentially send them here and ask them to read the section on clearing your cache, okay? So that way that they could learn how to do it. So I just wanted you to be aware that that resource existed.
Teresa, this is Kathy. I'm sorry, were you done with what you were saying? Otherwise,
yep, I am. Yep.
Okay. I just wanted to go back to the signature. And while the last person that asked the question was talking, I pulled up the signature page. There is a date that the plan was sent to the person themselves on here. And I know she asked about a provider. I don't have a provider on this current example, so I wasn't able to quickly look it up. I do believe that there is a place in the support plan, but I would have to dive into that a little bit more to say when that was sent to the provider. And then I don't know the other questions she was saying that she felt were not addressed on the support plan page. I have one pulled up, if that's helpful, so that I could show you. I know we're at time though too. The other question about the revision is we're a little concerned about leaving a revised support plan open. We would again go back to what Teresa, where you had demonstrated how to do a revised support plan and recommend that they're closed out because the person, if we make changes in their support plan, we have to send the support plan to the person. And there's also data that is pulled from the system. And we're a little concerned that if we have open support plans, that data is not going to be pulled. So I just wanted to add a couple of those things before we ended.
Yep, yeah, and we've talked about that too in the past with the MnCHOICES support plan application is each change you make, you kind of save the point in time so that you're aware of what the changes were so you can kind of sequentially follow it. Is how we've talked about it in other systems in the past, but you're right, we are at time. And Kathy, I think that if you guys take the care coordinator signature piece back, like I was hearing Sue and Deb do, that we could potentially address it in the September webinar, and I can set aside a slide for that if some information is ready to be shared at that time. So I think with that, we need to close today's call because we are at time. And I again just want to make sure I take the opportunity to thank everyone so very much for coming today and really coming with good questions and having great dialogue and having the opportunity to do that. And please know that this will be on the DSD archive page. I think that's what this one said before. So you will have the recording of it and the PowerPoint available to you if you want to go back to it for any reason you can, or if there are people who missed today's conversation and you would like them to be able to listen in, they will be able to do that as well. So again, thank you very much. This was great conversation. I'm so glad we had the chance to do this with you. And work through the questions that you have so that you can move forward with your next phase of launch. So again, thank you very much. And we are going to go ahead and stop the recording if you could, Anna, and then we will leave the session for today. So again, thank you. We're sorry we got started a little late because of the email coming to you late, but this was a great session. It was very fun to do. So talk to you later.